So, welcome to the MindSea podcast series, Moving Digital Health. Our guest today is Chris Cullmann, Executive Vice President and General Manager at Rev Health. Welcome, Chris.
It's a pleasure to be here. Thank you.
Yeah, thanks for joining us. Maybe you could briefly describe your role at Rev Health.
Absolutely. My role at Rev Health is to help our clients identify how to make the best use of digital and emerging media and channels, how to use data, and quite frankly, what's become the more traditional, boring story of digital marketing: search, email, display advertisements, in order to you have a more effective marketing. And in particular, in the age of COVID, how to overcome where access through reps and healthcare professional marketing and patients who may or may not be seeing physicians at the same cadence, how to have the same kind of continuity and communication and effective communication in deciding exactly what kind of therapies would be appropriate for them.
Interesting. So I know Rev Health has like different service groups, I guess, and which is there one of those that is your focus, or?
No, as in with most of my career, Rev Health has essentially a center of excellence that is there to support all the different operating units. We have strategists and user experience teams that are deployed against specific accounts, but we have our core offering, which would be Rev Health, the umbrella brand, which largely just promotional marketing to healthcare professionals, payer audiences, as well as medical education. We have First Amendment, which is very much focused on our patient communications and being able to access those audiences, which are typically aligned with advocacy. Virtuvius, which is very much aligned against science and communication. I actually have a little bit less contact with there because it's a lot of pre-commercial. Obviously, this has been created in order to respond to market changes and market demands as the organization has grown. It's refreshing. It's an independently owned organization. It's been around 16 years. And I think our service offering is one that's really oriented around the dexterity of being able to come to our clients with solutions that are not only the right size, but effective for the kind of results that they're looking for when they begin the engagement with our organization.
Mm-hmm. Nice. It sounds like you guys are covering a lot of ground there. Is there any like particularly exciting projects you're working on right now?
There are quite a few. I think I'm fairly limited in what we can talk about. We work on a lot of launch brands that are pre-FDA. I think what's most exciting, and I think reflective of what's going on inside of the space, is where we're heading from a data standpoint. And I've been fortunate enough to work inside of healthcare for almost all of my career, a little bit older than I probably care to admit at the moment. But one of the things that's interesting is we went from a market that was 5-6 years behind the consumer market in both professional and consumer marketing. And we've just come such a distance, in particular post-COVID. We were already accelerating really quickly, but what's happened since COVID has really affected, I think, us globally, but specifically in the US market, is data and non-personal communication has really taken centerpiece relative to our being able to reach these audiences and deciding where we were going to put specific marketing dollars at any given point. What's, I think, really interesting about the healthcare market is we have an audience, the prescriber, who's not our end user. The patient is the one we're addressing with therapies, but the decision maker, and one that in some cases rate limits what our actual end user, the patient, is seeing, because they're making the recommendations against their professional experience and the craft and training, but one that every decision is leaving evidence. Prescription products are normally aligned against them, a physician writing a prescription or making an order in a hospital setting, for them to say that they're making a choice and a preference. And in particular, when we talk about the use of ICD-10 codes, to make a choice and selection against the specific diagnosis. So there's a lot of data that's available inside of the market just with that. And there's a lot of other data fields associated with the practice. So when I talk about what I'm most excited about, and I think what organizationally we're very much excited about, is how do we intelligently use this data And not just data for data's sake, but how do we really make smart decisions with data? How are we able to, not look at this massive corpus of data and all the individual feeds, but how do we really cherry pick those very specific salient points of data that are going to make a difference for marketing? And I think we do it in a lot of different ways. We've launched our own DSP this year. We've really moved ahead in search. We've really looked ahead at using both dynamic analytics on the websites in order to dynamically change content, but also make decisions about where we're driving these audiences based on their propensity of behavior or how we've identified it and targeted them using an endemic media partner or perhaps a channel or even the reps involved in that decision-making process based on the conversations they're having with the physicians. And when we look at selecting the next piece of narrative that we're going to serve to a physician, and albeit even a patient in a lot of these instances, even with HIPAA in place to protect the patient's privacy, there's still a lot of opportunity for us to intelligently listen in a respectful way for privacy to help lend a narrative that's going to have a more meaningful user experience and one that's going to really help participate in putting the right materials in front of someone who's in the position to make a decision about either their own therapy or a therapy for their patients.
Mm-hmm. Yeah, there's definitely a lot of stakeholders involved there. And you mentioned the prescriber. And obviously, traditionally it's medication they're prescribing. Have you seen a breakthrough of any of the digital therapeutics or in that field?
Yeah, I've seen a couple of different instances. One, if we look at space like the multiple sclerosis space, we've participated in programs that have both connected injection mechanisms that help the patients understand how proper adherence to a therapeutic regimen is going to be more beneficial, and in particular, how to get better feedback intuitively from their bodies in order to help moderate that. And I think some of the other things that have happened very exciting inside of the space is beginning to experiment with categories that traditionally have been a little far off ahead from digital therapies. One that is a specific note is looking at treatments inside of the schizophrenia area, where a couple of manufacturers are experimenting in the space in using sensors and data capture components inside of pills in order to get a better understanding as to how to make sure adherence is first and foremost, but also to be able to take in body signals and see whether or not there's any physiological responses associated with the cycle up and down of being able to do moderation using CNS drugs. I think one of the things that's become especially evident in this past year is that I think there's a renewed sensitivity around privacy and what we'll call like ownership of data. That was not part of the original enthusiastic rush into mobile health 2 or 3 years ago, when we're starting to see the release of, a lot of wearables, a lot of data trackers. I think the tenor, the cultural zeitgeist has shifted a little bit, and I think there's a lot more sensitivity around data. But what I also think is important is that patients are considering that there is a tremendous benefit to data philanthropy. And that's not necessarily pertinent to say like a manufacturer's therapy. But when we look at moving into categories that have like just large suites of data, something inside of the oncology space, like a breast cancer or lung cancer, there's a populace of patients there that, statistically, we can get a lot of value in looking at things like comorbidities, height, weight, gender, whether or not we're going to look at family medical history or genetics. And for there to be sharing of that data, I think, you're at a tipping point with the volume of data that you can make some really safe assumptions about what specific therapies are going to work and how that's going to be applied. At the other end of the spectrum, you have rare diseases where every little bit of data that could be shared inside of the clinical space, anonymized, can give a lot of different insights into other patients that are trying to find their way. So rather than have these pockets of small populations where you're trying very hard to activate the insights and very quality as to the data that you're able to capture, being able to pull that data and have the patients volunteer that data can be a tremendous help to another patient or a caregiver who's going to just start their journey. And I think those are some of the tenets that we need to discuss culturally and to figure out how comfortable we are and what are going to be the guidelines. I don't mean necessarily, federal guidelines, although that is important, but really like what are the cultural agreements that we're going to have about anonymized data, and in particular being able to help, other people who exist inside of the same patient population that we do, and being able to provide something that is really giving back to the community in the true sense of the word.
Mm-hmm. And in your experience, how willing are people to share their data once it's explained to them in, how it will be used in an ethical or anonymized way?
My exposure to it, and I work a lot with a manufacturer, so I think that probably tempers a lot of the responses that I'm hearing. I think that there's a little bit of reluctance. I think if the physician is going to be the one who's going to advocate for that, and it's done in the context of something like a clinical trial data or an EHR, that there's going to be a lot more openness to it. So I think a lot of it is what is the positioning of that experience for the end user. I think in a lot of patient populations, though, there's a lot of apprehension and reluctance, and rightfully so, to volunteer and work collaboratively when we talk about data sharing. And this is where the component of that being the kind of the cultural zeitgeist. I think the U.S. in particular, we're a fairly polarized country right now in our views around a lot of things, and I think that there are a lot of pockets of mistrust. So I think working with advocacy groups and working with clinical organizations that really have developed an academic rigor and a profile that's available to the public perceptually can be a huge help into us finding soft ground in order to land those things. And in particular, to be the advocates for being able to capture that data and showing back to the community the value of that data. I think one of the challenges we have, and it's evident in, we do work both in Alzheimer's and several other neurological diseases where, I think there's a pushback from the community about the expediency of accelerated FDA review. And I think that there's a lack of understanding as to how the FDA approval process works and how manufacturers interface with the FDA. And I'm not trying to act as the pharma apologist here. I just think there is a lack of understanding about the role of the FDA relative to protecting patient populations, and secondarily, how that process works when it's an unmet need. And I think the most polarized example is if you look at, Biogen coming into market and there being probably a pretty vocal portion of both the patient advocacy population that's pushing back against the accelerated FDA review. And then you look at how much anxiety there is about the FDA not approving COVID solutions in the same voice in the same year. I think it speaks a lot to an argument of convenience and not one that's completely, informed against looking at how policy works inside of a federally organized group like that. I also think it's true when we look at digital health. Like only 3 years ago did CMI really approved physicians getting reimbursed for looking at digital data. And the governance laws over, what we talk about digital health or even protecting patient privacy are relatively immature relative to how quickly the platforms are advancing.
Yeah, for sure. I think there's a lot of information there. Obviously, things are changing at a rapid pace. But also sometimes the regulations are lagging behind. I'm wondering, if we want to talk about the patient education, side of things, what mediums or techniques are really, working, communicating with patients?
Social. That's an easy answer. I think even 2 years ago we were talking, and it's still relevant, but Facebook was really the space where we wanted to go in order to both identify patients in their journey, awareness, education, there being a value proposition, or from a marketer standpoint, a conversion point. Still very much relevant into how targeting works and being able to find a very large population of what's traditionally the aging well. you get your nice sweet spot of, everywhere from 45 to 70 on Facebook in a pretty healthy population. What I think is interesting is the speed at which TikTok is moving into a lot of these patient populations. And it's distributed in that you see pockets of certain disease states that have like just massive amounts of dialogue, both influencers who are, making really strong, high quality content that's relevant to audiences, and even physicians. Whether or not you have one in extreme like dermatology, which, seems like low hanging fruit, but you have a lot of, dentists, even starting to see oncologists and psychiatrists that are starting to talk about issues inside of their practice to other peers inside of TikTok. So I think you put that together, and people are still spending a lot of time. And in particular, if you're a patient suffering from a disease, that's content that is really not only valuable, but that you find personally compelling. And you're going to be drawn to those people like you who are going through that same kind of experiences. And even physicians are starting to, see their downtime exchange inside some of these platforms. For someone,
I guess, has the privacy restrictions enforced by Apple on, Facebook, on mobile and that sort of thing, has that made it harder to reach those people?
I would say Facebook's restrictions have probably been the most evident. It's still not completely clear what those ramifications are going to be. We have seen some deprecation in performance inside of the channels, but the actual conversion mechanics, when we look at the platforms as a whole, are negligible. I think that there is, very much evidence of the tenor of the conversation, question you had a couple of minutes ago. There is a sensitivity inside of a lot of people's homes now relative to privacy. I don't think a lot of people truly understand what they're pursuing when they talk about privacy. At the end of the day, all of these devices, whether or not it's Apple, Android, or any other platform, you're compromising your privacy for free content when you go to sites that are advertised driven, even if they don't have trackable advertisements on them. It's still around exchanging your time in exchange for data and the value of content, typically in exchange for access to from a marketer standpoint. I think it's very appetizing to listen to what Apple's value proposition is, but they are also still providing a cohort to a marketer in order to provide access. And I think that's very palatable for someone who works in healthcare. We're not very interested in reaching Jane Doe or John Doe. We're much more interested in reaching somebody who's in a portion of their journey that we can provide value to. Transactionally, the marketer in healthcare is not very interested in the individual. That's really the role of CRM, and you've already opted into an engagement in a relationship. And I think that's a lot of the false argument in being able to create the construct of targeting inside of these ecosystems. I don't think there are many marketers who are trying to reach John or Jane Doe. That's just an easier way to be able to provide an identifiable handle for somebody who's at the point of a transaction where they're likely to make a choice. Like how close are you to a commitment of making a decision for any one of the legs of this journey? And I think that's the most interesting thing. And I think a lot of marketers look at it that way as well. So, being able to have identifiable cookies and even email as a targeting mechanism is much more about circumstance and urgency than it is about really being able to get to, who that person's identity is.
Yeah. And do you think patients and users understand that, really when it comes to their data, a lot of the times that, like you said, people aren't interested necessarily them as a specific individual, but more as, their membership in a group or cohort, like you say?
Yeah. I don't think even now, when I talk with, people I know, friends, family, and even some colleagues, when we talk about them, like how targeting on a platform like Facebook works, they're usually shocked at the level of accuracy that you can get. And they see it as you describe it as like a personal violation. But the fact is, like, you're leaving evidence of your behavior everywhere you go. And this isn't new. It's just incredibly convenient and in real time. supermarkets have been doing this for like 40 years. Direct mail houses have been doing it longer. Like the mechanics of being able to get a club card in any one of these things, you were trading for coupons, your consumer behavior, and, quite frankly, access to your name and address, and your spending habits in a really personal way. In particular, if you're buying any kind of, healthcare aids at the supermarket, right? But I do think that this idea of privacy is an important one as we're trading our behavior at a very granular level. When we started this call, I told you I had to shut off 2 computers to make sure I didn't have any alerts. Like I've got, like I'm giving up a lot of my behavioral insights when I bring my phone with me anywhere along the way. And I think those are some of the things that we want to make sure that we there's some awareness of. And I think it's especially evident inside of healthcare. And as an organization that builds a lot of apps, I think one of the value propositions that the app platforms are putting forth are the mechanics of things like, Apple's health solution, where you're able to preserve the data on a device level and have a real construct of both integrity and security that's built around that exchange when it's labeled health data. The same is true inside of Google's platforms as well, although not nearly as popular or as well marketed. And when we look at the proliferation of something like the Apple Watch and Fitbit to some degree, I think that there's a big opportunity to reinforce to this patient population that data is personal. It actually is a big value to, if you're going to talk to your physician about your overall health, these signals are critical. And in particular, that data, if not visualized, is of little use to the physician. Like I can walk into my physician's office with a year's worth of data in a spreadsheet. Without it being visualized, the physician is neither in a position to review that data in any granularity, nor are they provided a way to be properly reimbursed for that outside of like reviewing the digital, health data. But being able to show them my health dashboard inside of, my iOS device, it plots out averages, a couple of spots were of concern. Again, having worn an Apple Watch for a long time, like, my pulse dropped below, I got like a warning for BPM in the middle of the night. And it was like, well, okay, it's not, like a clearly calculatable healthcare issue. But what's interesting is physicians would be like, okay, well, that happened twice. We'll consider that not a concern with you when we look at your overall health because it's been visualized here. Right. And I think, that there is an opportunity for these platforms to act as, conversation points that have clinical rigor behind them, because you're looking at a corpus of data that the physician can say, well, this was a year's worth of data. Look, like you're relatively flat, which is the way you should be. Your at-rest heart health is here. If we look at any cardiac events, that's here. It looks like you're doing a regular regimen of exercise where you're working 10,000 steps a day. Like you're presenting to me a profile of somebody who is, fits in moderate health. And, I have your blood pressure and your weight and everything else right here too. It creates a really round picture.
Do you find that like physicians are more open to looking at that data, or when someone comes in with their data from the Apple Watch and they say, oh yeah, that's fine, but that's not real medical data, or we can't rely on that, or they actually look at it and say, oh yeah, this is actually a really useful data point that not to be taken on its own, but a starting point to maybe look at something a little closer?
I think the physicians I've spoken to, and I'm in a fortunate space to, talk to a lot of physicians through exposure through my work, but even my own physician, which is anecdotal at best, but I'll talk about the volume of physicians I typically talk to, are refreshed when the patient comes in with that, not because it's some treasure trove of data, because they have someone who's actively engaged in participating in their wellness. Yeah. They have a corpus of data that's like, oh, okay, well, if you've been wearing your Apple Watch for a year, like I've got a year of data where if I want to like deep dive into it, it's here. But like I'm looking at someone who's lowering their their overall blood pressure for a new Apple Watch, or their at-rest health has been like moved from 70 to 65 due to exercise. But I'm looking at someone who has a regular exercise regimen that includes motion, some anaerobic expiration, right? Like even if they're bringing their heart level up to a high level for 15 minutes a day, I can see that. And now I can talk to the person, not in the context of, if every physician tells a patient, like, we need to exercise more. What does that mean? Well, now I have a construct of, if you tell me that you're exercising a lot and you're doing a half-hour physical activity a day, well, I can tell you what I need you to do is 15 more minutes a day. Right now it becomes actionable and it's measurable, and I can put it in a chart, and now a nurse can have that conversation. I can move to a telemedicine exchange where I'm talking about, well, I'm not seeing you face to face. The last time we were together, you were doing a half hour a day. Like, are you up to 40 minutes a day? It really does change a lot of the parameters, because now the physician and the patient are having a shared dialogue where they're both looking at the same core data set, and it's one that the patient is using as a metric for their own success. So right. And it changes a little bit of the parameters. Like, I think Peloton's a really good example of, in participating in a Peloton, like it's logging your activity, right? So it's a different kind of health metric. And I would argue that, physician, you're only looking at a snapshot, but you're looking at someone who's at their most performant when they're exercising, right? Well, let's look at your peak. And let's look at your, you're starting your cool down and warm up. And now I'm getting a profile of like, if you do this a half hour every other day and you're not bringing your heart rate up, or now I'm starting to see an increase of your optimal heart rate. Well, like that's good cardiac health as long as it doesn't go too high. But you're talking about someone who's like really working on a different level of calibration. I think, a Fitbit, or even those people who bring their phones on a walk, acting as a pedometer, it gives the dialogue to the physician, a rheumatologist, or any specialist who's working inside of like motion, a completely different way to look at engaging with their patients, right? Because it's a shared language, and it's a little bit beyond just having like, here's an appointment, let's talk about your health. You're talking about the parameters of something that you're wearing on your wrist or have clipped to your belt every day of the week. And I think the same is true of something like Alexa. I know there really still isn't a construct for Alexa to be a health aid. Mm-hmm. They just announced the product that is going to allow them to interface with the elderly patients in their home, aging patients, the aging well, right? It's a really interesting construct. Are you familiar with this new product?
No, definitely familiar with the Halo device, but that's different from what you're talking about, right?
Yeah, what they've done is they're offering a product. It's just announced. I haven't actually seen one yet. Is a product that is basically Alexa designed for those who are aging in their own homes. But it allows there to be a caregiver permission model, where both the patient and the caregiver can summon emergency services. For there to be a behavioral insight into what's going on in the home, so you won't see that the person's doing X or Y, but the person's mobile. The person made a call today, right? So it allows you to have a glimpse into the person's home and some insight into the behavior that's going on there, but without being overly invasive into the person's privacy. And it also allows the person who's aging inside of their home, the ability to have a lot of other services that are an enhancement that really look to, what are the tools that you would need if you were going to be aging with inside of your home that fit into the Amazon ecosystem. I think it's a good example of Amazon's done a good job is to make themselves accessible to a really wide demographic of people. And they also have a brand that's very much aligned with being able to offer a data-oriented program to the marketplace, because AWS backs many of the pharmaceutical websites, both from a database perspective and a serving standpoint. So it really is a nice overlay of two different components inside of the brand. And I think a good example of gently wading into the waters of how technology is going to be helping an expanding population of the aging.
Yeah, and a voice UI, via Alexa is certainly, a great way to interact with, elderly patients that, have trouble with, more graphical user interfaces like, apps and that sort of thing.
Yeah. And I also think, it's another example of Amazon's very good about creating APIs. So, looking at an ecosystem where you can add on to a service like that. For instance, those who are, there's an aging population which struggles with arthritis, right? And it's one of those degenerative diseases that if you're not physically challenging the disease in several different ways, it's the likelihood of progression is high. But two, it's a very easy way to calibrate on, if you have arthritis in your hands, well, the amount of pressure you can apply at any given point is a signal as to how much your pain is. That combined with reporting your pain. So this is something that you can create an extension to the Alexa program that allows you to apply pressure to a device. It reports it into this, essentially like what's likely going to be the Alexa hub for the aging. And for now you to have another data point that you can go back to the rheumatologist. So, anybody who goes to the physician, and unless they happen to be in a lot of pain that day, what's the biggest problem with someone who's suffering from arthritis, right? Well, it's all right, doctor, right? Well, the fact is you're actually in pain, which is why you're seeing a rheumatologist. And the fact is it could be getting progressively worse, but unless you're in incredible pain that day, it's not worse than it was the day before. And
people are terrible at self-reporting, right. And being accurate about it, right? Like,
yeah. So it's being able to intervene in those times that allow you to have data points that are going to help with the actual care model. And same is true. You look at any chronic disease, diabetes, as another example where, being able to chart that progress day over day, taking away insulin spikes, like you get a much better picture as to your overall wellness. And in particular, you start to overlay those behavioral things that you may not even be aware you're doing, but could be contributing to the degradation of the disease. And those are a lot of the narratives that I think are important to look where we as an industry are going. And again, kind of pulling it back to the narrative we were having around privacy is, look at the Amazon product, and I'm sure there's going to be a lot of sensitivity to it, to an aging population, right? But what are you getting in exchange? Well, your caregiver is getting, some peace of mind in knowing that, my loved one is mobile and upright inside of their home, right? So some assurance there without me having to call constantly. Two, the person who's there, what other services can we provide to make it more appealing to know that you're being observed at any given point? Right. Mm-hmm. And it's, you put those two things together. It's like we're providing a big peace of mind, a good opportunity. But, if the person who has the Amazon product installed in their home and knowing that they're suffering from arthritis or that they just had, hip surgery, well, what content can we introduce into that home in order to make that a better experience or more educated experience? Right. Which goes into another one of their categories.
Yeah, and it's back to the trade-off you talked about, right? Yeah. Yes, you are, sharing and your data and leaving all these footsteps, but that data is also the insight into the services or tools that can help you where you are in with your particular condition or day-to-day needs. Right. But I think there's still that trust bridge to be forged. And I think especially with Amazon, a lot of people will just think, well, Amazon is, it's all about selling things. So they're just trying to, find, different ways to sell anything, which may be true. But if it's the right thing that's, going to help you, live your life and be healthy, is that worth the trade-off for your data? So yeah, it's definitely a very interesting and kind of, nuanced space we're moving into with this more kind of, 24/7 monitoring type situation.
Yeah. I mean, let me ask you a question, right? So when you talk about the construct of being able to create, say, an app for Alexa, which I think fairly fits into the parameters of your agency, right? At what point are we as a manufacturer or an insurer, right? I'm looking from the business side of it, going to pay for that Amazon Alexa to be inside of your home in exchange for data? If you're a commercial insurance company, and you're talking about someone who fits into the coverage model of falling under commercial, well, that's a really interesting value proposition, right? If I know that you're exercising on the regular and I know you fit a profile, do I reduce your insurance premiums? It's those auto insurers that offer that, look, we can put a chip in your ODB port on your car. And that way I have a profile as to what your actual driving looks like relative to, not just mileage and, how many accidents you get into, but I can look at how fast you accelerate and how hard you brake. And I can fit you into a cohort for pricing. I don't actually have to look at your individual behavior. I just need to know, you fit into a specific profile, and that profile is assigned, a risk discount or a risk increase based on those driving behaviors. And then now becomes the positive feedback, right? Which is, hey, you're in cohort 6. We can lower your premiums by $200 this year if you move into cohort 5. Here's what you need to do.
Yeah, and then it benefits the safe driver, because they're actually paying a more appropriate premium for their behavior, that someone that might have the same demographic information but a much different driving profile, and it'd be the same thing for health, right? Like those reduced insurance premiums for a healthier individual that is staying on top of their exercise and diet or medication, it benefits the people that are doing the right things, essentially for their health or safety.
Yeah, and what's interesting is, and I'm curious to hear your perspective on this. When we talk about people's perception of data and privacy, I think one of the stumbling blocks is people don't have context to their data, right? Like that's one of the barriers to this, which is, well, I'm just giving up my data, right? But if you were to talk about insurance, like, well, if I was going to give up my health data in exchange for a discount, or my exercise behavior collected on a wearable to the my insurance company in exchange for a lower rate, what would be really beneficial to me is, like, where do I fit? Am I in the top 10 median? Am I in the bottom 10th decile? Like, you're ranking me, but I don't understand where I fit in. If I knew I fit into a comfortable modern, like a medium, well, maybe I would be a lot more comfortable with it. Which is like, yeah, sure, you can have my data. I'm just like, Joe average. Versus, well, I'm an outlier. Well, now I'm a spectacle, right? And I think that's part of the apprehension, is that people, they don't know what they're exchanging because they don't know where they fit. And then that's where this idea of kind of data philanthropy, I think, comes from, is why it resonates really well with me, because being able to give it forth without the personally identifiable information, I think reduces a lot of the risk. It's just, I don't think people believe that it could be completely de-identified. And in some instances, I think it really can't be and be meaningful. But I think there's an opportunity to start to have that conversation around, how much can I give up? Where is it going? What's the value going to be? And what do I get out of it? And I'll pause there.
People like you or me who, work in this space and kind of understand that trade-off, might be more willing to, to share data because of that, that understanding, right? But I think there's been a poor job done of, communicating to people, what some of the benefits may be of sharing their data. And also, like you said, the instances where, that data is collected and then it's breached and it gets stolen, and it just all goes to, breaking that trust and, creating the fear of people that like, no, I gotta hold all of my data tightly and, keep it under lock and key, because any data breach is going to be a bad thing for me. Where it's much more complex than that.
Yeah. And I also think, you and I think are looking at it through one perspective, which is categorically, like, where we practice is one level, but, being, in a non at-risk population is another, and then our age is another, right? There's a younger, like kids coming up today, they've only lived in a world, like I've worked in a world pre-internet. It's not very pre-internet, but it was pre-internet. But if it's anyone like 10 years my junior only knows referencing via a screen. And now you move back to like, so like I have a 10-year-old son, like he's growing up in a world where his data will follow him around for the rest of his life, both in social media, school records, email. He already has an email account, so it's like, I think there's going to be an adjustment, several good and bad. Like, I think there's going to end up being a little bit of indifference relative to data privacy because it's too much. Like it's just too much to manage. Like some people are good with their finances and other people aren't. Like I think it's going to be like that kind of conversation. But I also think that there's going to be a value adjustment against that data model, right? People are going to start to realize they're giving up a lot in exchange for a little. And there's either going to be a rise of privacy and paying for services, or there's going to be a lot more protection mechanics that are going to be put in place in order to allow people to have a clear delineation into what they're putting forth versus what they're getting in exchange for their data, specifically like personally identifiable data.
Mm-hmm. And with that younger generation, do you find that greater awareness of, or, growing up online makes people more free with their data or more cautious about sharing it?
I would say the context that I've had any kind of like conversations with emerging adults, like young adults, I think there is some apprehension around it. Like I do think that there's a sensitivity to, I'm positioning myself, into the world and into a market that I need to be cognizant of what I'm putting forward and where I'm putting my data. I think that I think that's it's going to end up being part of maturing. And I think there's going to be a little bit of a resurgence into kind of anonymous profiles online, like there was when the internet started, right? Where there was a lot of apprehension about even doing like financial transactions. Like, I'm not going to put my credit card in there, right? Like, I'm not going to shop online. And, that has come full circle. And I think there's, not from a shopping standpoint, but I think that there is going to be kind of a rise of people having pseudo personalities and pseudo profiles for online communities.
Yeah, well, and almost in the way that people would perfect their image for social, right? Only sharing the images and photos and moments that put them in a good light. You could look at the same thing happening with data. Where people are kind of like filtering and being like, okay, I'm only going to let out this data that like makes me look healthy, or maybe even actually editing, and people getting like to that level where now I'm gaming the system with the insurance companies because I've gone in and forged data that makes me look healthy and active when really that's not the case.
No, I think it's a good point, right? I think it's like the Wild West. I also think it's interesting as we talk about profiles online. Both Apple and Google have mechanisms in order to obscure your identity to third parties, but because we're carrying the devices around with us, there's kind of this single point of truth. Apple offers a service that allows you to obscure your email address and protect your privacy to some degree there. But there's no fooling Apple. Apple knows where those accounts reside. Google is very much the same. You have a canonical, identity, and whether you obscure it or not, there's a lot of behavioral indicators that allow you to eventually like come to that person. So you have this. Yes, those statements are true, but these large tech giants, which are under scrutiny for regulation, at least globally. That's a little bit of what's like, wow, there's a new regime, and it's actually, more omnipotent than country and geographic policy, right? These things actually transcend geopolitical ties, and they are becoming kind of nation states in their own right, although they haven't, I think, really like flexed that policy. But when you look at the amount of data they have access to and their ability in order to tilt things experientially, like it is something that we need to be cognizant of as individuals in the choices we make, and also on a country and political level.
Yeah, because it does get more complex when you have an organization like Google that has, all this data and provides services across the world. But then specific countries will, take issue with their, privacy policy or, the way they're targeting users, so that, Google now has to customize its providing or its services like for that specific region. And then it gets, fragmented across all these different, exceptions as well. So, as you add on those layers of, technology giants and, government restrictions and, different types of data from different sources, it just like layers of complexity just keep building that, make it so challenging to regulate and find ways to, organize and, make data, more manageable for an individual user, right?
No, it's the truth, and overlay that into EHR systems, which as sophisticated as they are, surprisingly disparate in their connection to one another. I think that's data interoperability actually at a healthcare system level. I think will be the next kind of major subject matter for, at least for the U.S. market, to deal with. In countries with socialized medicine, I think it'll end up being governed a little bit differently. But in the U.S. market, it's just so fragmented. And even within inside of the same hospital organization, there's really a lack of operability to be able to provide data from like an imaging center to, a cardiologist who's on a different floor of the same hospital, and vice versa. And I think those are the things that are going to have like the most immediate effective impact on things like cost of healthcare, outcomes data, and reduce the cost of healthcare, quite frankly, in those privatized systems. I think that that's a much more boring story, quite frankly, but it's one that's actually going to be a lot more important nearer term.
Yeah, and I think it is something that almost like is just glossed over because it's been in such a big issue for such a long time, and it's hard to tell whether we're actually moving forward on interoperability or not, right? It seems like it's kind of stagnant, and there's been so much talk about the the standards and like HL7 and FHIR, but like how do we know we're moving towards and getting closer to that goal of having interoperability between the different systems?
Yeah. Well, I think what, to tease that out is like, well, what are the success metrics? Is it, being able to have, like a markup specific for data variables? Is it about speed of, transaction? Because those are two very different metrics. One of them being like prolonged resonance of data and accessibility, like kind of like an open standard, versus, well, let's reduce the barriers like within inside of a network and see whether or not like you can keep the data operability construct, like within inside of an imaging database, but how quickly can we make it interoperable through like middleware to the larger EHR network? Like what's the right argument to have when like, Siemens or Philips owns the imaging tool, and then, Cerner owns the EHR system, and, nobody's bothered to write the middleware. And quite frankly, no one has the licensing to write the middleware, right? Mm-hmm. I think those are like, which one's going to be the most expedient? And in particular, where's the most monetary value to any of the individual stakeholders there, the hospital included, because they want the better outcomes data.
Mm-hmm.
So I think these are not conversations we were having like even 6 to 7 years ago. And, where's that talent pool coming from, right? Like, where's the computer science expert who has a degree in like health economics? Like, find me that unicorn and like you could solve that problem, right? And in particular, if they're motivated. And I'm sure those people are out there. The question is like, well, how do we activate them in this modern space where we're still having conversations about like, like how do we change admittance and just general outcomes? And some of this is technology based, some of it's policy based.
Mm-hmm. Yeah, agreed. That unique skill set of someone who really deeply understands the medical field and also has the technology side is certainly a very valuable skill set. And I know here locally, actually, our University of Dalhousie has a health informatics program that kind of combines those two things, specifically. The intersection between kind of health and technology, which I think is, has a huge potential to make an impact in the future. But it takes a long time for all that to happen.
Nice. What are some of the challenges that you're seeing inside of the marketplace? I mean, I think you're dealing with both healthcare clients and dealing with like the on-device security, on-device networking, end user experience. What are those challenges that you're seeing, and how are you tackling them?
So it's interesting, working on mobile devices with Apple and Google. They have pretty good ecosystems, and Apple especially. If you are generally like following the guidelines for how to build secure apps, then you're in a good position, whether it's personal health information or financial information or whatever. Android is a bit more challenging. There's more ways that people can kind of reverse engineer the app and get in there, but it's really more at the API layer and the back end that more of the challenges are, because it's the data in transport, and obviously that's encrypted, but the where the data is stored in the database and the vulnerabilities there are the bigger issue. And sometimes we are building the server as well, and so that's something we have to handle. But a lot of the partners we work with, have their internal team that are managing that side. So we just have to work with them, really closely to ensure that the data is kind of kept secure from end to end. There's also partners we work with where we have built the system and essentially locked ourselves out for to maintain like the strictest level of privacy, so that we can't even kind of hand over the keys to the clients. So the minimum amount of people possible now have access to that data.
Yeah, it's a good policy to have. Because I think part of the conversation we even had as agencies is, what is the liability of an agency? Like, 5 or 6 years ago, it's like if the website was up and running and you didn't have any security breaches, that was good. Now it's a question of, how do you maintain persistent APIs? What happens when you have policy changes in the platform level? Who's responsible for data integrity? Do you really have any like principles of elasticity in regards to how long data will remain solvent inside of a database? There are like a lot of like pseudo ethical questions, like when we talk about healthcare data and preserving healthcare data. iOS is a great example. Like that health data gets stored in iCloud and can move from device to device. At what point are you not expiring that? 8 years ago, I liked to, pound jelly donuts and have beer all day. Well, that was part of the health record that I would want expunged, right? And how do I do that? How do I do that if I'm going to then apply for a health discount for looking at my health data? Some really interesting, concepts on ownership and integrity of data that I think are unanswered. And I think a lot of people are going to be uncomfortable with, and rightfully so.
Yeah, no, it's really interesting. Even the the idea of kind of, declaring data bankruptcy and saying like, okay, I want to separate myself from this past data. So I'm going to like close my old accounts and, have a new iCloud account and a new Google account and all of a sudden try and like, start fresh. I don't think a lot of people are thinking about that right now, but it's, something that might become more common in the future.
Right. But like, is that obscuring? Like, if, can I sue to get access to that data as the insurer if, 4 weeks later you have a heart attack, right? You've obscured my view into the data, right? Like you've lied to me, right? It's no different than just because you tear up a prison record doesn't mean you don't have a prison record. You know what I mean? Like, it's still like some of these, like I said, it gets into like these like interesting conversations about like ethics and knowns, because, those are records that exist. And is Apple are they in a position where they will expunge that account completely and it's not, no longer discoverable? Like there've been a lot of questions about people who erase their Facebook profiles and then they're not really erased.
Yeah, exactly the same thing, right? But yeah, and the question is whether that's your right to to erase all that data, or you're legally, if you've signed a prior agreement to share that data and then you get rid of it, then you're in breach of that contract with whoever that may be from, right? So yeah, definitely an interesting topic to explore. Let's switch gears a little bit. I'd love to hear your take on storytelling and how you use that to communicate with patients.
Yeah, I think storytelling is an important part of allowing the healthcare narrative to land with patients. The fact is, I don't think that there's any huge epiphany for a lot of patients relative to their disease state. Dr. Google will typically answer a lot of really high-level questions. What becomes pertinent is, how does this become meaningful and actionable to me as an individual? And this is part of why socials become, a big part of any kind of, healthcare marketing program. And quite frankly, healthcare culture is, we go to look for other people's stories. How are they coping with the disease? What is their narrative? How does this one deal with a loved one who's suffering? I want to find someone like me, right? So it's important that we're able to find these individual elements and find things that are going to resonate with us. It's a big part of, making sure that we have people who look and sound like our patients in campaigns, and that there are narratives that are accessible to different patient populations when we put them into market. We want to see, even physicians want to see other physicians responding to products. Why? Because we want to have that true component of empathy. We want to know that someone else is going through that experience. And in particular, we want to hear what those experiences are like. I think there's a lot of inherent mistrust in advertising in general, which, from a culture that's relatively cynical, like I get. But it's those peer-to-peer experiences, when they're authentic, that I think land especially well. For those that are more of a construct, like I think it still needs to be able to, I need to be able to have that resonance, right? I need to be able to see my own story in what's being told and identify with it. It's part of the reason why, being able to pull in, celebrities and influencers means so much, right? These are people who already have like an equity with a lot of, of the audience. And we're borrowing that equity in order to provide, get access to their ears and minds. So storytelling is a big part of what we do. I also think storytelling is a really important part of user experience, right? I think a lot of our clients have this vision that a patient or HCP a healthcare professional is going to come to a website, you're going to come onto the homepage, and we're going to read your story, and we're going to find that call to action that's most pertinent to you. And we're going to spend several minutes reading through your site. I think when you talk about storytelling, like everyone's going through a journey. And if you're interacting with content in the middle of the day, you may be at a desk trying to interface with the patient, and you actually don't want to engage in the story. You want access to that information. That's part of the story, right? Being able to fit and provide a value to that physician by making it accessible easily, that's the story, right? To the patient who's looking to really understand, well, what's it like to suffer from the disease? What should I expect to go through? I was just diagnosed with the disease. What's going to happen? They're looking for stories. They're looking for a narrative that, like, well, it may not be my specific story, but like, okay, what are 10 stories look like? What can I expect? That's a big part of how storytelling fits in too. And I think it's got to be specific to the product, and it's got to be specific to where the product is in the marketplace too. Not every brand's a hero. Sometimes, being able to have that information in front of the patient that's really matter of fact is everything that patient needs.
Yeah. Just providing value at that moment in time. Cool. Well, just realizing that we're actually running a little bit over on time here. There's definitely more we could talk about, but I feel like we've had some great conversations and certainly some great material here. I know for me, I'm just like trying to keep up. I'm like, wow, it's just like a wealth of information here. And it's really been cool to chat with you.
Very passionate about the subject, passionate about the industry. I'm fortunate enough to have found something that I love participating in, and it's right at the intersection of kind of creative communication and technology, and it's the right time too. And it's an exciting space to be in, as I'm sure you found as well.
Yeah, I think it's certainly a very interesting time to be, working in the digital health space. And I think for me, the most exciting part is there just seems to be opportunities abound for, improvement and value to be created in this space. And that's what excited me, to see that like there is so much farther we can go. And seeing where we can take it in the next several years.
Yeah, agree. And listen, it's going to be rewritten several times in the next decade. It's moving fast.
Yes. Yeah, 100%. All right. So Chris, I just want to say thank you for your time. It's been really interesting to chat with you and to hear your perspective on these issues. Hopefully we can connect again another time.
Yeah, really exciting to have the conversation. I appreciate the dialogue. Thank you for inviting me.
Cool. And thank you for everyone that's listening, and hopefully you got something out of this. If you like this episode, please subscribe to the MindSea newsletter, and we'll notify you about future episodes.